Hi, and welcome back to Surviving a Stroke or Brain Injury. Today I have with me my beautiful speech therapist, Allison, and she has so graciously allowed me to interview her for this video. So what I want to talk about today is speech language pathology. I said that pretty good, right?
Yeah, you did.
And what it involves and entails. So it involves speaking, listening, reading, writing, comprehension, attention, memory, visual processing, and problem solving. A lot of us don't realize that speech therapy involves all those things, and then probably more than that too, but those are the ones I came up with. So speech therapy exercises are great, great. I'm living proof for improving language disorders like aphasia, which I have. These disorders occur when the language center of the brain becomes damaged after an injury or a stroke. Brain injury, sorry. The language center resides in the left hemisphere of the brain. Therefore, aphasia often occurs after a left hemisphere stroke or brain injury. Speech therapy exercises help improve language skills by sparking neuroplasticity, the brain's ability to rewire itself. Through neuroplasticity, that word, neuroplasticity, whatever, healthy areas of the brain can take over the function of the language center of the brain. So speech therapy encourages exercising the new areas of the brain to take the function of speech and communication. Neuroplasticity is activated with repetitive stimulation. So constant speech therapy is required for best results. So now here's my speech therapist, Allison. I'm not going to say
Hi.
your last name, but Allison, thank you again for doing this. I really appreciate it.
Sure, of course.
So what type of schooling or training does a speech language pathologist, also referred to as a speech therapist, need in order to work with the stroke or brain injury population?
Yeah, so in order to become a speech language pathologist, you have to have 4 years to obtain your bachelor's degree. And then you have to attend 2 years of graduate school to get your master's. So you can't practice as a therapist unless you have your master's. And then part of your graduate coursework is completing 2 internships, one in a school for speech therapists that choose to kind of go the school route and work with, younger children in the school setting. But then you also have to do an internship in a medical setting. So a hospital most likely is where you have to do that sort of internship. So once you complete all of that and you pass the national exam to get your licensure and everything, then on top of that, you also have to complete a year, what's called your CFY, which is a clinical fellowship year, where you have to, your first job that you get right out of graduate school, you have to find someone who's willing to kind of be your mentor and look the work that you're doing and sign off that you're competent in what you're doing. So it's not until you finish that first year of work before you can actually get your official license. So it's
Wow,
it's
so 7 years?
a lot of work. Yes.
Why didn't you become a doctor over a speech therapist?
I'm just passionate about what I do, and I really like this field, and I kind of felt a calling to do this. So
That's
yeah.
important. And without people like you, there's no way people like me could achieve our goals without somebody like you. So I really appreciate everything you've done.
Oh, well, thanks for saying that.
I hope you don't mind I'm referring to my notes.
Oh,
but what
fine.
different, huh?
I said you're fine.
What different types of speech and language disorders do therapists teach? And also, do they teach like swallowing too? Because I had a problem with swallowing in the beginning.
Yeah. So in just kind of terms of talking about working with the stroke or head injury population, a lot of the disorders we treat are kind of what you mentioned, aphasia, which is a language disorder. So your ability to express yourself verbally or to understand what's being said to you. So that's a pretty common impairment after a stroke or a head injury. Also, your ability to articulate your words. So there's lots of speech articulation disorders. The fancy name is dysarthria, which is just weakness of your oral motor muscles following a stroke or a head injury, to where you might have that slurred or kind of drunk sounding speech.
Like I do.
You've come a long way though.
Thank you.
And then absolutely, yes. So speech therapists also evaluate and treat swallowing disorders, which is not something that everyone realizes because that's not in our title.
Right.
But a lot of what speech therapists do in the medical setting especially is to evaluate and treat swallowing disorders. So absolutely. And then also another thing that people don't realize is that speech therapists also work on improving cognitive impairments.
That's what my next question was. Yeah.
Yeah, so that and
can you explain what cognitive is?
Yeah, so your cognitive skills have to do with your ability to reason, problem solve, organize your thoughts, your ability to do executive function tasks like balance a checkbook or simple financial math that's relative to your everyday life and that sort of thing. So we use those skills all the time in everyday life. Yeah. So it's really important, especially after a stroke or a head injury, that that's part of your rehab and working on those skills, because if you get home and realize that you can't do that stuff, it's really frustrating and upsetting. So yeah.
Plus too, numbers may look different to me than they do to you. So finding out what the real number is important for everybody concerned, because that was a real problem that I had.
Yes, absolutely.
So what type of deficits in regards to speech therapy do you often see in a person after they've had a stroke or a brain injury?
Right, and so we kind of touched on that with the last question too, but a lot of time, like I mentioned, the aphasia, so your ability to express yourself or understand what's being said to you, and that plays into your reading and writing skills too. So that language center that you talked about in the very beginning, housed on the left side of your brain, that is responsible for your speaking, your understanding, your reading, and your writing ability. So chances are, if you've had a stroke or a head injury that affected the left side of your brain, then all of those areas of our language are probably going to be affected in some way or another. So that's real common to have those deficits after a stroke or head injury. Again, the dysarthria, the slurring of speech, is very common. And then dysphagia, which is the fancy word for swallowing disorders. So just like muscles in your legs and arms are affected after a stroke, so can your swallowing muscles be affected. So a lot of times, we have to do a swallow study to kind of recommend the safest diet for you, whether we have to modify the texture of your food or the thickness of your liquid so that you're not aspirating, meaning stuff going into your airway when you're swallowing. A lot of times we'll have to do exercises to strengthen those muscles or your oral muscles. So, a lot of, especially immediately following a stroke or a head injury, in that acute phase, when the patient's still in the hospital, a lot of times swallowing is the main focus of the first part of what a speech therapist works on, because we want our patients to be able to eat and drink normally as quickly as possible.
And it's a drag, because at the beginning I could only eat potatoes, mashed potatoes, half shakes, insures. It was a drag until I learned how to eat solid food. So it sucked.
Yeah.
In terms of recovery, what do you think, or swallowing also, what kind of timeline do you think maybe somebody may be facing for this kind of trauma?
Right. That's kind of the $1 million question that everybody wants to know. When am I going to be back to normal, or when am I going to be all better? And there's really no right answer for that, because everyone is so different. Your age has a lot to do with it. So the age you are when your injury happens, obviously the younger you are when the injury occurs, the faster typically recovery is, just because a younger brain is more able to heal quicker and more elastic. So we can kind of rewire things like what you were talking about quicker versus, an 89-year-old brain. But also the area of where your injury occurred or your stroke occurred, that makes a big difference. The size of your injury, all of those factors kind of play into your recovery process. But the number one thing I always tell people is you've got to have motivation to get better. You've got to put in the work with your therapy to get the most out of it. And that time frame immediately following your stroke or your injury is your prime window to rebuild and regain those skills. So everyone is different, but if you've got the motivation and you work hard, you're going to see results faster.
Can you kind of address that? I know it's touchy, but my doctors told me after the 6 months period, that's the only progress I'll have. That's how I am at 6 months is how I'm always going to be. Well, I'm glad to report that's not the case.
Sure.
But it is slower. So can you address some of that?
Yeah. So it is common knowledge, and it has been researched that the prime rehab window for improving and gaining momentum and regaining a lot of your skills is 6 months following the injury or the stroke. However, to say that no progress can be made once you hit that 6-month mark, that is not true. And I can attest to that just because I've worked with so many patients who I've seen 2-3 years out from their initial injury.
Me.
Yes, and they were still able to make noteworthy progress. Can people go totally back to where they were prior to their injury? Not typically. There's always going to be something they have to compensate for, or they have to, rest more, or, there's all these things that you kind of learn to adjust to. But absolutely progress can be made. So I don't agree with that statement. I do understand where they're coming from and saying the quickest and fastest progress is going to come 6 months, following. However, even tiny little bits of progress absolutely can be still achieved after that 6-month mark.
And it seems to be slower because at the beginning it seemed like I was recovering pretty quickly.
Absolutely.
And then after that it like slowed down.
Yeah.
But I'm still here, I'm still working, and Allison can attest to this. I speak a lot better than what I did when I saw her in August.
Absolutely. Yes.
So there is hope. I had no inflection. My voice was very monotone and lower, and it's slowly building. It just takes time.
Yes. So and you probably have to put in a lot more work
every day
now than you did, when you were first starting out.
And I hate to differ from our questionnaire, but what do you say to people after speech therapy? Because it doesn't end afterwards, after therapy.
Right. Always when I kind of am seeing that patient for their final session, because, unfortunately insurance is not going to pay for speech therapy for years and years. I always give my patients kind of a list of resources, whether it be apps they can download on a tablet or their phone, websites they can use for cognitive retraining, workbooks they can purchase if they're interested, and then different materials where they can go there. The internet is such a great resource for finding so many things. So, you have, like you said, you have to keep working on things. It can't just be, well, I'm done with speech therapy, so that's me done. I'm done working on things.
Right.
No, it has to be, it's got to be a lifelong thing that you put work into, especially if you're still trying to achieve some personal goals with the way your speech sounds or your word finding or your memory, whatever it may be, you've still got to work at it continuously.
And to add to that, Allison told me to over-exaggerate my words, which I'm doing, And if I go slow, because when I get excited, I tend to run my words together. So go slow, and then put pauses in between each word. I never saw that as a big deal, but it is a big deal, and it does help a lot. So thank you.
Sure.
Um, what kind of challenges do you face working with brain injuries and strokes? I mean, like mood swings, obviously. Um, how do you handle, because
Yeah,
I'm sure some people don't want to do it and some people are angry.
sure. It's something you just kind of learn when you're first starting out. I was fortunate enough at the beginning of my career to work in the acute care side of a hospital at Parkview. So I got a lot of experience right out of the gate in terms of working with people in the ICU and the neurotrauma unit. And that's kind of where you see a lot of those behaviors, especially right after a head injury. A head injury involves emotional injury too. So
Yeah.
your ability to regulate your emotions, to know when you're being overstimulated by sound or light. A lot of people don't register that right away. And so their reaction is to be angry because they're overstimulated and their brain
Yeah.
can't handle it right then. And so you just kind of learn to educate the patient and their family members on those behavioral changes that they'll see, and let them know that it's totally normal following a stroke or a head injury. It's very common for a stroke patient or a traumatic brain injury patient to go from laughing to crying in a split second. That's a
It
very
is.
common. And people are like, what is wrong with me? Like, I've never cried before. Why is this happening? And it literally is just part of the injury to the brain. Your brain can't regulate those emotions anymore. So a lot of therapy is working on that as well, and knowing how to be appropriate in social settings, and appropriate when you're talking with your family members. It's
Mm.
kind of, you really have to relearn all of that stuff. So once you work with that population for a while and know what is normal for them, it's really not hard to, adjust to those behaviors, because you know that they can't help it. It's just part of the injury.
Plus two for me, and I'm only speaking for me, but I was 46 when I had my stroke. And one day I was normal, single mom, going to work every day, doing the regular things. And then bam, my life changed in an instant. And so
That's
part of it was my emotions were all messed up. And part of it too was I was so frustrated and sad
Yeah.
because I was in a wheelchair. I couldn't communicate because my whole right side was paralyzed. So I couldn't
Yeah.
write anything I wanted to say. I couldn't speak. I couldn't swallow. I couldn't, you know. So I was mad.
Well,
Just
yeah,
mad.
rightfully so. And it's very, very common to experience severe depression
Yeah,
after a stroke or a head injury. I mean, like you said, nothing about life as you've known it is the
right.
same. And
And I
so,
was mourning that. I really
yes,
was.
absolutely. And it's totally normal to grieve that. I mean, anyone would. So we have to remember to give these patients grace, that they're going through something. Unless you've been through it, you really don't
Right.
understand what it feels like.
And plus, too, I want to emphasize this. In my last video, I did too, but I want to emphasize this will end. It may take months, it may take days, who knows? But it
Right.
will end. I don't want
Yes.
to say I can't control my crying now because I can, but the madness has disappeared. When I'm angry, I'm really angry, and I know it.
Sure.
When I'm sad, I'm really sad. But the crying, I can cry whether I'm happy or sad now, and I can't
Yeah,
control it. So but it does get better, and
it does.
caregivers, please have compassion and understanding because it does get better. Don't take anything personally
Right.
because it's
Absolutely.
not about you, you know?
Yes.
So,
Very good point. Very good
um,
point.
so I know what we did in our sessions, but what does a typical speech therapy session or stroke or brain injury look like?
Yeah. So again, it kind of depends what your deficits are. If you're aphasic like you were with trouble finding your words, a lot of in the beginning, it's very basic skills, looking at an object and being able to name it or talk about what its function is, you know, and then
That
kind of
is so frustrating because we know up here, but we can't say it.
right. So it's all about baby steps, you know, kind of you have to master the very basics before you can kind of graduate into more complex things. And then kind of what you and I were working on when I saw you last summer was very high level things, you know, where you had to, list items in a category or some, you know, we kind of were doing much higher level things, or listening to a set of clues and trying to name the object.
Right.
Kind of like a riddle. So there's different, you know, levels of what you're working on depending on the patient's skill level. As far as dysarthria goes, or the slurred speech, the weakness, doing those oral motor exercises where you're working on the tongue, the lip, the teeth. Yes. Yeah. To strengthen those muscles so that you can produce more clear speech. And then also your talking tasks. You know, I gave you a set of words that were kind of the problem sounds for you, and you know, you were just practicing saying those out loud over and over with those strategies we talked about, the over exaggerating or the talking louder or slower. As far as swallowing goes, like I touched on this earlier, you know, depending what the deficit is with swallowing, if it's, you know, the oral part of your swallow or the pharyngeal, the throat part of your swallow, there's different exercises we can train people in to improve those muscles. You know, we do something called vital stim, which is using electrodes, kind of like a TENS unit, where you target those muscles, and you do the exercises with the vital stim to kind of give the muscles an extra oomph when you're working them. So we do that a lot. And then as far as the cognitive stuff goes, gosh, we've done everything from playing different games to
you playing games with me. I love that.
Cards, working on different puzzles, or you know, just anything where you're working on higher level skills. Maybe I do a lot of math skills with patients, especially if they were the one in their household who managed all the finances and they want to get back to being able to do that. You know, we might do like a pretend scenario of, okay, this is what you spent this month on groceries, and you know, they have to kind of come up with a budget, or you know, something that's functional for them. So there's so much that you can do depending on what deficits the person has. But my job never is boring, because each patient is different every time. And what I'm working on is different with everyone. So
one of the favorite things I used to look forward to doing with you is Allison had her phone, and she would put up your head, and I would have to think of words, but I couldn't say that word. And was it called the Ellen game?
It's called, it's her game. It's called Heads Up. So it was a great word finding game for you, because you had to describe the word, but you couldn't say a version of the word.
Which was hard. Plus, it helped me talk more, because I would have to say the word, and I would have to think of what the word was, and I love that game.
Yeah, that was fun.
So other than that, what can people do to improve, or what can I do to improve?
Just kind of what we talked about. You always have to kind of keep working on things. So, you know, practicing your oral motor exercises just to keep those muscles moving. You know, another thing with speech therapy, you don't want to, or any therapy, you don't want to lose what you've already gained. And if
you don't use it, you lose it.
Right. If you've worked at this and gotten to a level you're happy with, if you just stop, it's gonna, you know, atrophy just like anything else.
Yeah.
Oh, was that you? Or?
Yeah, I got a text.
Okay. So you just have to keep working at it, you know. So like in your instance, it's those exercises for your lips, your tongue, your cheeks. You know, continuing to do your talking exercises, working on the sounds that are especially hard for you, continuing to use those strategies. And then always, it's good for any person, regardless if they've had a stroke or a head injury, to do games and little things that engage your mind.
Yeah.
So whether it be, you know, fun little games you download on your phone, or if you like to do crossword puzzles or word searches, or, you know, anything like that where you're using your cognitive skills, that's good for anyone.
Right. In my next video, I'm going to give, I still have the games you gave me to download, so I'm going to, can you see them?
Oh yeah.
Yeah. So I'm going to say those next time in my next video, because those help me too, because like I said, after speech therapy ends, your therapy doesn't end. You have to
Right.
continuously improve yourself, and
Right.
no cheating, because you're the only one that can do it. You know?
Absolutely. Yep.
So if somebody wants a speech therapist, I know probably after a brain injury or a stroke, they are assigned one in the hospital automatically.
Right.
But afterwards, how do you go about getting a speech therapist?
Yeah. So usually when you're once you're discharged from the hospital, a lot of times a person will be set up with home health care, which that's the type of agency I work for now, is a home health care agency. And that means that usually all the therapies that you qualify for and that you need will come into the home and work with you at home. But again, that's kind of just short term, usually, you know, a month or month and a half, maybe two, if depending on, you know, what level you're at. And then typically after home care, if your therapist still feel like you would benefit from ongoing therapy, they'll refer you to outpatient therapy. So you know, you'll usually transition to an outpatient clinic or facility. And then after that, it's kind of tricky, because insurance doesn't you know, like to pay for a ton and ton of therapy. We have to end it sometime.
Yeah.
So you know, if you ever have a new injury, like God forbid you were to have another stroke, that's considered an acute event, so you would qualify for, you know, a whole new round of therapy and everything. But I've worked with patients, you know, even in your case and Jessica's case, because I worked with Jessica too. You all, you know, were a few years out from your injury.
Yeah.
And you both were still wanting to work on things to where you can kind of get back in that mind frame of possibly working again, or becoming more independent and that sort of thing. And so a lot of times, if you just talk with your doctor, whether it be your primary care doctor or your neurologist, you know, and let them know, hey, I really am still having word finding issues, or my reading comprehension. Yes. I would like to work with a speech therapist. You know, they just have to write a referral. And then
so even months after or years after, in my case, you just have to call your doctor for a referral.
Yes.
Okay.
You have to have a doctor's order, but you know, most doctors are wonderful in listening to their patients, and they'll get them the service they need. So it just takes a convo with your doctor.
And it takes effort on your part, because you have to want it too.
Right.
I mean,
Absolutely.
people aren't going to just give it to you. You have to want it.
Right.
Can you go
Right.
over kind of what you and Jessica went over? What was Jessica's problem? Because hers is different from mine.
Yeah. So for her, hold on just a minute. My son's yelling. Cooper. Okay, so you had asked what I worked on with Jessica. So her thing was she had some aphasia like you do as well, but a lot of, she knew what she wanted, she knows what she wants to say and get it out, but just getting it out correctly and pronouncing things the correct way is really hard for her at times, especially if she's tired or that sort of thing. So worked on a lot of that. Reading and writing. Spelling was something that we kind of worked on. And then just kind of like with you, higher level cognitive tasks.
I noticed too when I'm talking to her that she kind of gets an accent when she's tired. Where does that come from?
Yeah, she is kind of unique in that way, because I haven't had many patients that do that. I think it's not so much an accent, rather it's just it comes from that language center of her brain being injured. with her stroke that it's just her speech doesn't sound fluent like it used to. It doesn't sound normal for her. And so it does kind of come across as a bit of an accent or just different than what she normally sounds like. And I think it has to do with when she's especially tired
Yeah.
or stressed or anything like that, which that always will affect someone's speech. If you're especially tired or anxious, worked up about something, it's going to affect the way your speech
Yeah.
sounds.
That is so true.
Yes.
Well, do you have anything else to add before we end this?
I don't think so. I think I just wanted to say I think it's awesome that you're doing this channel and giving support and advice and education to
Thank
people
you.
who are going through what you've been through. I think it will be such a light for so many people. So I think it's awesome, and I'm very happy that you're doing it.
And also, I'd like to say that Allison is the one that introduced me and Jessica, because I told her at the end of our sessions, I'm like, if anybody needs anything, they can always call me just to talk or somebody to have support or something, and she followed through. So thank
Yes,
you for bringing me and Jessica
absolutely.
together, and
Yeah,
I
I'm
just
so
miss
happy
you.
you guys have become such good friends. That makes
Yes.
me happy.
Thank you so much. Okay, Allison, well, thank you very much, and hope to see you soon. And I
Okay,
hope you watch my next video.
okay. Take
Bye.
care.